I'd like to introduce myself. I'm Priya, the Ventures and Portfolio Manager at StartUpHealth. I get the opportunity of working with our wonderful health transformers, which I'd love to introduce and bring on stage now. We'll kick it off with some introductions. If everyone could just briefly introduce yourself and the health moonshot vision that you're looking to achieve. We'll go ahead and kick it off with you, Raihan.
Sure. So my name is Raihan Faroqui. I'm an internal medicine physician. I'm here representing inRecovery. Our moonshot vision is crushing addiction and providing addiction treatment and support for everybody.
David, go ahead.
I'm David Haddick. I'm the CEO of PSYCHeANALYTIcs, and we are specializing in primary care behavioral health, providing technology to support a workflow that involves team care and primary care.
My name is Maureen Fura. I'm the CEO of Mammha. Our health moonshot is creating the gold standard of care for pregnant and postpartum women for maternal depression screening and care and recovery and feeling better. Thanks.
I'm Yared Alemu, founder and CEO of TQIntelligence. Our moonshot is to dramatically improve treatment outcomes for pediatric trauma.
Awesome. Well, thank you all for being here. My first question, as it relates to the pain point that you're solving, what is one thing that you would like every partner, investor, collaborator to know about the market and pain point that you're looking to reduce?
Yeah, happy to start. So, with addiction, the idea is that there's a revolving door. It's a chronic disease. Patients are coming in and out of treatment centers. At inRecovery, what we've realized is that peer support, family support is really critical to keeping people clean at home. So how can we virtualize 12-step programs like Alcoholics Anonymous for the various conditions that we have, and then scale that throughout the country? That's really the key of fighting addiction long term.
David, go ahead.
In primary care, we have a 60-year history of research that proves that combining behavioral health care with medical care leads to the best outcomes at the lowest cost, the shortest recovery time for patients. Yet it's 60 years on, and it's just now becoming known. So we believe that we need a workflow that will support behavioral health in primary care. And we think that part of the reason it hasn't gained more traction in the last 60 years is because it was too hands-on, manually implemented by putting more and more burden on providers. Now we have team care, where most primary care clinics have multiple providers in nutrition and behavioral health and social work, but they aren't organized. We screen patients before they come to the office on their cell phone, and we provide a report to the team so they can schedule the appropriate people to be available for the right patient at the right time.
Awesome.
Yeah, Maureen, all you.
I love how we're all pretty aligned in the stuff we're trying to do, which is great. What I want people to know is that we are the only product on the market right now that is increasing physician screening. Right now, only about 5 to 6% of physicians are screening for maternal depression, yet it's the #1 complication of having a baby. We've made it easy. We've streamlined that. We make the results go back to the physician pretty instant, and then care is immediate. So we have care coordinators. We've increased significantly the percentage of women who are engaging in care. The national average is 15%. We've risen it to 90%. We know what we're doing because we've been looking at this for 12 years under the hood of the healthcare system. We know what levers to pull. We are women who slip through the cracks, so we have hit every single pain point. And that's why our work is really working, and we just want to make it bigger.
So the adverse childhood experiences, 25, 30 years ago, CDC and Kaiser Permanente looked at longitudinal studies and said, what happens to people who have these traumatic experiences as they go through their life cycle? And the results were devastating. Right? So if you have 4 or more of these events, you have about 50 to 20 years loss of life expectancy, of chronic disease, substance abuse, mental health issues. So So what we do is trying to intervene early, trying to identify the severity early. So we use an objective data, about a 60-second voice sample, and being able to quantify the problem severity, and then give that information to mental health providers, right? So, and also support them as the person goes through the treatment process, track treatment outcomes. And then we know what happens between treatments, like in between sessions, right? So I'm a psychologist by training, so say, I'm gonna see you today, and then good luck to you until I see you next time, right? So we're also in a, remote monitoring of high-risk patients, so they will not use inappropriate level of services, right? So it's improving the disparities in treatment outcomes. And we focus on kids from low-income communities. That's where you have generational and ongoing trauma that plays a significant role undermining the person's productivity and being able to live quality of life.
Absolutely. Maureen, this next question is for you. So obviously the journey of a healthcare entrepreneur is not easy. Do you feel that that's compounded being a female entrepreneur especially?
I haven't felt that yet. I do feel like in my space, there are a lot of male-centered companies, which is, I think that's why we're getting it so right, because we know you can't just give a woman a piece of paper who's juggling babies or pregnancy and work. But I feel like it's also one of our strengths in the area that we're working in and why we're getting it so right. But I have seen there's few of us, so it's exciting to be here.
Absolutely. Raihan, this next one's for you. So your company has successfully launched your first enterprise deployment. What was the approach or strategy in terms of, entrepreneurs getting to close that first contract?
Yeah, it's a great question. So we partnered with Karen, which is a large behavioral health and treatment addiction company in Pennsylvania. The initial approach is you have to sit down with all the team members in the medical space, right? I think lots of startups that are, product-led or engineering-led will say, hey, we know what we're doing. Having clinicians on the team, I'm a health equity and growth advisor. We have Don Kripke, who's a clinical psychiatrist by training, and then working with David Sarabia, our CEO, who could not be here. We had extensive surveys with every level of provider and staff at Karen for several months before we even deployed, right? So you lead us, and then we'll build what you need. If you ask clinicians, they'll tell you, right? So actually having them there with us, but having them test the product while we were building, which can be very difficult to scale that model. But we had lots of learnings how we could kind of replicate that at our next couple of deployments. But it took almost about a year to do that. And when you're working with enterprise health systems or hospitals, that type of highly engaged workflow can be really beneficial of getting that first contract right. So we were very purposeful when we did that.
Got it. My next question's for everyone in Yared. We'll start with you. What motivates you as you wake up every day to continue building and innovating and growing your company? I have my own personal experience. I grew up poor in Africa, and when I came here, the thing that made the most difference is being connected to a quality mental health provider, right? And so my education and the other stuff was secondary to having that positive experience, right? So went to graduate school. I'm a psychologist, and as I said, this space, right? So this is kind of where there is still limited innovation when you're looking at low-income, pediatric. Kids don't have money. Poor people also don't have money, so they attract very limited innovation. But that is, we don't believe that is true. The opportunity to make social impact, a significant impact, is there for the taking. There's also a lot of money flows into that area. So Medicaid pays more than the private health plans, like the Blue Crosses. So we think this is,
we have kind of a double mission company that we do not separate, for example, the opportunity to make a social impact as well as the opportunity to make a lot of money. Those things are not, is not separated in the way that we operate.
Absolutely. Maureen, would love to hear from you.
So when I got pregnant with my son 13 years ago, I didn't think I'd make it through to the end of the pregnancy, and I wasn't sure if I did deliver him, I wouldn't make it much further on. I have no idea how I was able, with all the support that I had trauma, I didn't understand what was happening. So I have to fix it, and that's what a lot of women who have been through this, we are all moving this systemic gap shut, and so until it's shut, I can't seem to let it go. Because no other woman should have to not be a mother or die to be a mother. So that's what motivates me every day, to just not give up on this.
Absolutely. David?
Everyone in my company has some sort of touch with the mental health services that are available in this country for the last 20 or 30 years. And to say they're suboptimal in the case of identifying patients with subclinical or subsyndromal, they like to use that term, subsyndromal issues. Not acute enough to need a referral to a psychiatrist, but not well enough to be healthy. And so what keeps us going is the need to screen patients in primary care for a range of issues so that their treatment is based on the context of their symptoms. Symptoms without context aren't very helpful. You tend to focus on a very narrow aspect of a person instead of treating the whole person. That's what keeps us going, and it's important more than ever now that we are seeing the effects in the last 2 years on health equity, or the effect of health inequity, the lack of equity in healthcare. And so we've been working in the Medicaid market primarily, and that's where our heart lies right now. Thank you.
Last but not least.
Yeah. Lived experience, as Yared said, hearing about lived experience and drawing upon my clinical practice, those are the 3 areas of motivation. Our CEO, David Sarabia, could not be here. We have a team in Ukraine, so he's there helping them out, helping to shelter refugees. And he has a story that he tells, and I'd like to tell it. When he was very young, he learned how to code at the age of 12. He's always a builder. And he sold his first 2 companies by the age of 26, and that went to his head. He moved to New York, and he started using cocaine and heroin, and he almost died. And he also saw one of his friends almost die. When I first heard that story, it really took my breath away. But I know lots of people like David Sarabia, right? In the boardroom, on the streets, in clinic, we would see many patients. I'm internal medicine by training. We would see many patients coming in. Upon further interview, you unpeel the layers of that onion, understanding how are you coping? And then you hear about, I took this sleep aid, or I've used alcohol a couple of times this week to cope with something, right? The problems are not apparent. They require some digging, and it requires that connection. I think those 3 things kind of really motivate me. But I think the biggest thing is stigma. There's so much stigma about addiction. Addiction treatment is a privilege. It is not a right. And I'm motivated by trying to make that a right and democratizing access to care and, decreasing that cost.
Absolutely. And we have time for one more question from everyone. So if you could wave a magic wand and in 15 to 20 years, everything you're looking to accomplish would come to fruition, what would that look like, and what kind of impact are you looking to leave behind? Yared, we'll start with you.
We can be able to screen mental health / trauma symptoms at the primary care pediatricians level, and focus more on prevention and early intervention rather than the person have fully developed their trauma symptoms. So kids who fully develop trauma symptoms, it's very difficult for them to learn, very difficult for them to build relationships, do the things that are developmentally appropriate, right? So you have to reduce the symptom first, and then you have to do the skills training, and then you have to make sure that they engage in pro-social behavior. That's why you have, it's very difficult to treat it once it's fully developed, and we can do a lot better. The cost of not treating it, right, on annual basis, about $770 billion. This is something that we can dramatically reduce that cost, improve quality of life, right? So this is where someone doesn't have to be a genius or don't need to go to colleges to have a decent quality of life, but they need to have a lot less, right? A lot less psychiatric symptoms, right? Even in terms of thinking about treatment, I'm more kind of on a Freud group and saying the goal of psychotherapy is not to make people happy, right? The goal of psychotherapy is to help people live with the everyday unhappiness, right? And but it's a lot of people that their life is right now is about surviving, right? And they can't breathe. So it's imagine a kid, right, in a school setting, walking around 100 pounds in their back, right? And they look at themselves and they look at other people, and what they're gonna do is they're gonna start comparing and start feeling bad about these trauma symptoms that they did not create, right? So we're focused on really identifying trauma systematically, objectively, from a perspective of biomarkers, and being able to come up with not just mental health treatment, but also early interventions that are evidence-based.
Mm-hmm. Maureen?
We're looking to change the conversation around motherhood, to break this taboo and this stigma that motherhood is not always rainbows and unicorns, getting women better faster, and changing health outcomes for generations. When your pregnant and postpartum mother is experiencing depression and anxiety, this impacts generations to come, changes brains. So if we can treat those women now faster, then we've just changed a whole generation to come. So that's our moonshot.
Absolutely. David?
Well, this is really an easy question. In 20 years, I expect that healthcare will be well care.
Oh, nice.
I expect that we'll be able to start a company based on prevention and find funding for it, because there'll be some reimbursement path for prevention. Everybody's laughing up here, of course.
No, it's beautiful. Like, I want to snap my fingers. It's awesome.
And in 20 years, we'll be there, because the training programs take about that long to evolve, from medicalized treatment to whole person treatment, because we know the body-mind connection is a real thing, and we know that we can make ourselves ill by the way we think and the way we behave. So educating people to take care of themselves is one of the biggest goals I think we can all share. Thank you.
Healthcare is sick care right now, and we need to do a lot better. 20 million people have addictions in the US. 1 in 10 can access treatment. In 20 years, if we could bump that up to 5 in 10, if we get 10 million people to access treatment, I would be really happy that we've made an incredible impact. Addiction treatment is really expensive. For many people, it is a privilege. It can cost several thousands of dollars in inpatient rehab. And to Yared's point, if you are poor, you do not have thousands of dollars. So how do we build a system where we are destigmatizing addiction, we are understanding comorbid mental health conditions, because it's all interconnected? How are we thinking about structural, inequitable barriers that we have right now, from race, gender, transportation access, sexuality, religion, the list goes on. So there's multiple layers here. And if we could decrease the cost, by 5x, I think we'd have some serious impact in 20 years.
Absolutely. Well, thank you all for your time. These stories, the mission is so impactful. I want to thank you for your time here. And if everyone could give a round of applause for our wonderful panelists.
Thank you.